Hello friends, I am Dr Amogh, a consultant general surgeon and a coloproctologist practicing since last 11 years in Thane. So today we are going to discuss a very common topic, that is constipation. So in India, almost 16 to 17% people are affected by constipation. So we should discuss what is exactly a constipation and how to avoid it. Now what is constipation? Now by definition, if there are less than 3 bowel movements in a week or less than 1 bowel movement in more than 3 days, that is called as constipation. Now what exactly causes constipation? Now constipation exactly is caused by many things, mainly by a recent history of a major illness. It can be medical illness or it can be a history of major surgery in the past, recent history of antibiotics, any pre-existing comorbidities like thyroid, diabetes, cardiac diseases for which people are taking regular medicines, especially antiplatelets, then lack of fiber diet, lack of water, lack of adequate sleep, sedentary lifestyle, etc. etc. So these are the common causes for constipation. Now let's see how constipation presents. So obviously everyone knows constipation presents that people are finding it difficult to pass motion. So most of the times they have to strain for motion. There is sometimes maybe accompanied blood along with it. They may feel bloating, there may be pain in the abdomen, there may be a sense of incomplete emptying of the motion. So that can be the various symptoms of constipation. So now let's come to investigations of constipation. Now how to diagnose a constipation? First you have to take a detailed history. As I have told already in the causes, you have to find out a recent history of any major surgical or medical illness, any other comorbidities, any medicines which he is taking, and the lifestyle of that person. Now accordingly we need to run some investigations. We have to find out what is the tone of the muscles of the terminal part of the intestines, that is rectum and anal canal, for which we can carry out barium enema, we can carry out colonoscopy, capsule endoscopies, and anorectal transit studies. So once we are diagnosed with the constipation, we should first start treatment by dietary modification, lifestyle modification, in which we have to avoid spicy and oily diet. We have to include a lot of fibers, at least 20 to 35 grams of fibers daily, which will include salads like green leaf vegetables, avoidance of bakery products, then adequate water intake, plus you have to avoid certain medications if the patient is on those, if they are causing constipation, especially antiplatelet drugs, and in which cases wherein the patients cannot avoid the drugs, we have to either change it or we have to support it with the laxatives. Now laxatives basically forms the mainstay of the constipation. There are various types of laxatives acting on different types of receptors in the body. So basically they help passage of the motion. There can be bulk forming agents or there can be secretory agents. So they help passage of motion, and we may have to give them on a short term or a long term depending upon the history of the patient. And just in short, there is a recent modifications in the treatment, that there are some treatments like biofeedback therapies wherein an electrical stimulation is given to the pelvic floor muscles as well as to the rectum and colon, especially to smoothen the transit of the motions through the terminal passage of the intestines, help them passing motion easily. So just in short, to summarize, constipation is very prevalent nowadays in our, because of our unhealthy lifestyles and unhealthy food eating habits and lack of sleep, the fast lifestyles, etc. So we have to take care of all these things, regularly modify the things, avoid smoking, and consult a doctor even if we think that we are having early signs of constipation. Thank you.